Hello everyone, so today I'm going to be talking about hip fractures. Hip fractures are very common among older adults, and one can ask the question, why do these hip fractures happen? The article Evolutionary Roots of the Risk of Hip Fracture in Humans, published in Communications Biology by Avni et al., aims to answer this question from an evolutionary perspective. The authors compared the femurs of modern humans with that of other hominin species, such as pan-troglodytes and Neanderthals, to see what changes happened over time to give modern humans the femurs that we have today, as well as see what morphological changes led to an increased risk of hip fractures. The CT scans of the femurs were compared and results were tabulated. One result was that the species could be distinguished based on the shape of their femurs. So for humans, we're unique in that we have a larger femoral head, a shorter femoral neck, and an increased neck shaft angle. And that's very common of humans. And for pan-troglodytes, they have a larger femoral head, a taller neck, and a more shallow trochanteric fossa. One interesting finding about Neanderthal femurs was they resembled Neolithic hunter-gatherer femurs. And this leads one to the conclusion that Neanderthals were most likely adapted to be able to hunt. And now onto the main topic of our video. The human femur is more likely to endure a hip fracture than the early hominin femur. This is due to the fact that human femurs are evolved for walking on two legs and not for enduring hip fractures when we fall on our sides. The authors did something that I found very interesting, and that was propose an alternate construction for the human femur where the head and neck are at a 90-degree angle with the rest of the femur, and it attaches to the pelvis like so. The authors say that this would prevent hip fractures from happening as often, but it could lead to stress fractures at the neck due to just walking. So the way our femurs are shaped is a trade-off between being able to walk easily and, unfortunately, as a result, we have to endure hip fractures. Now, I have some references in the form of these pictures here, and this is comparing the prehistoric and protohistoric femur with a normal and a fractured femur, and as you can see, due to my handiwork with pens, this area is the greater trochanter, and that experiences some amount of depression when compared to the prehistoric and protohistoric femur, as well as this lower part of the femur is slightly bigger than it is in the prehistoric femur. Now for this view, same thing, you can see here a modification to the head where it's slightly depressed for the fracture, as well as the neck being being a little bit more wide in this area. And I have another picture, and this shows the normal compared to the fractured femur. Here, the red spots indicate just a change, not an increase or a decrease in the size. There's a great amount of change in the lesser trochanter as well as in the head. This is the head, this is the neck, this outside area is the greater trochanter, and this area is the smaller trochanter, the lesser trochanter. Hope you guys found that pretty interesting, as interesting as I did, and I will be seeing you guys next time. Thank you so much for watching, and have a wonderful day.